My name's Matt from Tampa. I'm about to go in, see Dr. Kolon, because I am broken, internally and physically. I train and compete in CrossFit, and I had extreme tightness in my joints. It's like a sharp pain. Just feels like needles. Use your wrists a lot, use your ankles a lot, and your hips when you're squatting. If it's tight, if it hurts, not only can, be hard to train, but you can hurt yourself. I look like I'm this great shape, healthy individual, but on the inside, kind of rotten, honestly.
Good morning. How are you?
Good. How are we doing? I'm here to hopefully get looked at, get worked on, and get fixed.
Can I have Matt to the back, please?
How are you?
Very good. I'm Dr. Kolon.
Nice to meet you. I'm Matt.
Absolutely. Come right on in.
All
Have
right.
a seat right at my desk. I'll follow you.
Perfect.
I see you here immediately. Powerlifting, wrestling. What brings you in?
Yes and yes.
Clearly, your physique shows for itself. Are there particular parts that you feel like really bother you when you're going through all this? Your knees, your ankles, your wrists, shoulders, all the above?
All of it. I have inflammation all through my body.
And you mentioned this because?
I'm post bone marrow transplant.
Bone marrow transplant as a result of what? What brought you to that phase in life?
So, 2014, I was diagnosed with leukemia, cancer in my bone marrow. I started chemotherapy immediately, and right into chemotherapy, I had complete organ failure like 2 days in. I was then put on life support for 18 days. Lost 60 pounds in the 18 days. I wasn't supposed to wake up, but here I am. And if it wasn't for my health and fitness, I wouldn't be here, 100%. That's when fitness became the biggest part of my life. Living here as long as I can with my wife and my son, that's top priority for me. Post-transplant, it's different now. My energy level is always different.
Absolutely. I have chills right now. Immediately, I'm connecting with him in my head, going, he has no idea what he's saying to me. Oh my God, oh my God. I had leukemia and lymphoma as well as a child.
Did
so
you?
yes, I did. I was stage 4 when I was diagnosed. So I got hit pretty hard. I went through a lot of months of chemotherapy, and we added additional radiation. So my body was really affected, and I really resonate when you sit there and you tell me, like, you have fatigue. Like, the fatigue was the hardest part. Like,
yes.
I just want to be able to walk from my room here, and I couldn't do it. Being a teenager, being diagnosed with stage 4 cancer was the most traumatizing things to happen to me, mostly because of how I looked at myself in the mirror, but also because of what we had to go through. It was devastating for the whole family, and we did our best to stay positive. And I do think that that positivity is really what got me here today. It just goes to show, like, how powerful we are as human beings, that we can really endure a lot in the worst of situations and come out like this.
Mentally, physically, yeah.
Right? Let's check in your squats.
Okay.
Let's look at your spine. Let's look at those wrists, and let's go from there. I asked him to go through a subset of range of emotions with me to see really where he was at so that I knew what was his next level we were gonna take it to. Try and touch your toes. Is that as far as you can go without bending those? Nope. Don't bend those knees for me. How far can you go?
Bend.
Okay, back up.
Yeah.
Any pain with that?
Oh, yeah.
You, like, slowly got up. You're like, yeah, there's pain, doc. I have him touch his toes. He's like Tin Man. Now I want to test out his shoulders, so let's see how he responds to my strength test. I'm 5'1". I'm a $110 on a good day, and as strong as Matt is, I know that I can go ahead and manually manipulate him. Thumbs up for me. Do not let me push. Resist me.
Okay.
Don't let me push. I'm taking you out on this side over here. It's okay. We're gonna have imbalances, but it's telling me what's going on with your body and what muscles I need to zone in on. I need to focus on his neck and shoulder muscles to get its balance back. Also, his cervical spine needs some decompression so we can create some space, get some more range of motion in the shoulders so that he can do these lifts without promoting injury. It's my job to get it back to a more situated space so that he can move better and with more fluidity. I'm tiny, but I pack a punch. So I know with him, I am gonna have to use a little bit more finesse to get through all this dense muscle that he has, and that's okay too. I put him in position and bam. There you go. There it is. Nicely done. Go ahead and go face up for me.
All right.
Pull this up. Great. It's just gonna open up that lower back. Okay. All the way out. Awesome, awesome, awesome. There it is. Now I'm happy. Woo-wee! So, hands just like this, cross them, put them right in your belly for me. Awesome. Holy moly. You got a headache central here.
Yes, yeah. You found my spots.
Getting him. Right here. You're gonna wiggle that left toe for me. There you go. Beautiful. You good?
Mm-hmm.
He just kind of like eyes roll back like, boop, reset. I don't know who's sweating more, you or me right now.
Sweating over here at workout.
But you know what? That sweat is actually really normal during adjustment. I get it. When you adjust my low back, because it turns on your parasympathetic system, turns on the central nervous system, and it's actually a reaction you get from being open, those nerves going, I can finally breathe, thank you. We've adjusted his sacrum, his lower back, his upper back. In his case, it's really important that we decompress his spine and open up the nerve pathways in hopes that he can touch his toes without doing the whole, robotic Tin Man thing, right? Remove your shirt for me, please. And then I'll get you nice and comfy cozies, okay?
All right, I will just lay
Perfect, I got it for you. So now I'm gonna do what we call static cupping. So I'm also gonna do some dragging. There we go. I love cupping. It looks weird, right? I put all these cups on him. I'm suctioning blood flow to this area. It's a great way to increase blood flow, and it's a good way to rejuvenate the connective tissues and also pull it from the bone to gain that mobility. Look at that, beautiful. So that muscle is stuck to that bone, and I'm suctioning it so that it can create more movement to help the shoulder range of motion so he can do proper lifting. And now you're gonna feel the drag. And I love this because I'm actually pulling those adhesions to create more space for gliding of these muscles. Look how tight you are. I mean...
I feel so good. Almost immediately, my posture has changed. My upper back, I could feel it's already loosened up. Felt amazing, and I loved it.
Now, I'm gonna use a tape, a sports tape, to get you back in that position. Chest up, right? And taking your shoulder from here to here, where it should be, right? Instead of rocked forward from poor posture and over-contracture. Love this stuff, okay? A little sports taping goes a long way. And the whole point is, one, we're gonna see the results, but two, you're gonna feel the difference of what your body should feel like versus what it feels like now. Right now, what we're doing is we're taping that supraspinatus, okay? It lies right underneath that trapezius, just like that. Okay, look forward for me. There you go, chest up. See how you're naturally wanting to fall back to where you were, okay? Yeah. So we're gonna use this tape to take that kind of stuff out. Okay, now relax. You feel like you have like a bit of a brace back on right now? A back brace on my shoulders, right? That's what it should feel like. Okay. It's the subtlety of just being able to go, okay? We're here all day, and we don't even realize it. We breathe like this, we walk around with tension like this, and all I did was do, back to basics. Arms up just like this. Don't let me push, resist me, don't let me push, resist me. Better, stronger. I took you out the first time we did that. Push, resist me.
Okay.
How are you feeling?
Feel good, feel great. Before, I could barely touch my toes, about here. Now I can touch the grass, so great job. Oh man,
so
my cancer bestie.
Look at us go, just kicking butt.
I feel really good right now. That's why I preach health and fitness, because that's what's kept me alive, and I want to live as long as I can for my family.
I'm Ryan, and I have arthrogryposis. Arthrogryposis is when your mother's pregnant with you, you don't have the right amount of room to grow in the womb, so you kind of get stuck in a certain position, and then it affects limbs on your body, usually the arms and legs. I just have to use my back for so much to kind of like maneuver my whole body. My best friend, TK, he helps me out. I'm just so used to being how I am, so I pretty much just tolerate pain. The thing that bothers me more than anything is my lower back pain, and I think that's because of like the way that I have to walk. Friends and family recommended a chiropractor, and so I'm here today from Fort Worth, Texas, to see Dr. Kolon with the hopes that she can help me. It would mean everything to me. Hello.
Hello. How are you?
Good, how are you?
Good. Ryan, come on back. Nice to meet you.
I'm Ryan, very good to meet you.
And you are?
I'm Tyler.
Tyler, nice to meet you.
You can call me TK.
TK it is. Ryan has traveled a really long way here today, and I'm gonna do everything I can to get him some help. Okay, so tell me what brings you in.
I have arthrogryposis. Like I can't drive and I can't like button my own jeans and, you know, stuff like that.
In those more severe cases, arthrogryposis, it can go to the spine, to the jaw. Would you describe yourself as that, or mostly just in the joints and extremities?
As far as I know, it's really just in my extremities.
Okay. Arthrogryposis is a congenital disorder where there is contracture of the joints. So someone maybe can't fully extend their arms or extend their shoulders, so you'll see kind of this motion or this motion. And we don't know how severe his case is. I need to get to know where he's at so I know how I'm gonna proceed. Right here on your x-ray, this is your cervical spine, or your neck, all right? You do have some degeneration to the disc itself. Am I all that concerned? Not necessarily, right? Because I see these things every day in a chiropractic case because there's gonna be some wear and tear to our bodies. I'm thinking like, I'm gonna find something crazy, and I didn't. I found degenerative joint disease and degenerative disc disease, which I'm not minimizing, but is clearly present in his spine and his neck from top to bottom. The good news is you don't look as bad as I thought we were gonna be. What difficulties do you have as a result of this?
I have severe vertigo problems and also lower back pain, given my disability with the way that I have to kind of like slouch over and walk. I would really like to be able to last longer outside playing with my son. It's super hard because I'll start feeling too dizzy or, you know, my back will start hurting. It kind of just affects my everyday life because I just kind of feel like I don't want to do anything, and it just causes me to have severe anxiety. The vertigo, I've learned to tolerate it, but I think that I could really benefit from, you know, like easing the pain of it. I like having to deal with it. My right ear also just rings like 24/7.
Do you currently have vertigo by any chance?
Kind of, a little bit, not
like a
lot.
little sensation-y kind of feel going on?
A little bit, yes.
Do you always have the ringing? Because the ringing is also different, by the way, from the dizzy spells. They're two separate symptoms.
Yes, I always have the ringing.
Okay. I'm looking at the vertigo and thinking, okay, let's see if there's maybe some PT or maybe some chiropractic maneuvers that we know to be Epley's maneuver to help maybe reset the location of the crystals and see if that helps with vertigo. It's part of those calcium crystals that lie in the inner ear. We usually tend to fare a little bit better with vertigo. I'm not saying always, just sometimes.
with the Epley maneuver.
With Epley maneuver. I don't know if I'm battling something that was already kind of damaged as a result of his disorder, but we don't know till we try, right? Have you ever been to a chiropractor?
I have not.
I've told him so many times.
I don't want someone to break me, you know, so it's
I
like...
mean, clearly. I mean, I would say the same thing, too.
Yeah.
And that's coming from a chiropractor, right? We need to proceed with caution and make sure that everything that we're doing is well within, you know, your scope and my scope, and make sure that you're comfortable. I'm gonna take a look at your spine and examine you. If you wouldn't mind, go ahead and stand up and take your shirt off for me.
Okay.
He has a severe medical condition, and this is a first for me. I have never seen anybody utilize their body like this, ever. He uses his body so differently than you and I would. He has a lot of strength in his neck flexors. I mean, these are built-up muscles, possibly tension too, as a result of constantly using it. Do you have a nice, good spine? I'm not gonna lie, you have a lot of tension in your lower back. Holy moly. With Ryan, it's really important to look to his neck. Why? Because if he can't use his arms, how does he shampoo? How does he cook? How does he brush his teeth? He's using his neck for all of these actions, even putting toothpaste onto his toothbrush. So essentially, there's an overuse syndrome, much like the treads in a tire that's had too many miles. So I'm gonna focus on his cervical spine from C1 to C7, or the area around the neck. And we still have to do Epley's maneuver to help with the vertigo. If you don't mind, just have a seat right here for me. I want to see exactly what you look like going face up first before I even do anything.
I was really nervous. I've seen videos and stuff on Facebook. I've always been kind of scared to do this. So if I don't get the help that I'm looking for today, I don't know what I'm gonna do, honestly.
Oh, okay. We are finally getting the adjustment started, but Ryan's face reads fear. I don't feel like I'm out of the woods just yet. You can definitely see the joint contracture, and this is my first time I've dealt with something this outside of a textbook. But I want to make sure that he's comfortable every step of the way. I want you to wiggle that right toe for me, please.
Ooh. I felt that.
Was it as scary as you probably thought it was?
No.
Okay. And this time I'm not going to ask you to wiggle your right toe, by the way, because you already know the trick. So this time I'm going to have you wiggle your elbow. That's it. Okay, now let's take a look. How does that feel now?
Good.
The whole way down?
Yep.
You just kicked some butt. I'm like super impressed.
You know, the crack in your neck, it's like just instant relief. Ooh. Once it's popped, it's just like, kind of like a breath of fresh air, basically.
Take me through some range of motion. Go from right to left for me.
Feel like I can turn more.
It looks so different, by the way. I mean, that's night and day.
It doesn't feel like there's so much tension pulling down on the right side, so it's feeling a lot better.
An immediate noticeable difference. He had so much restriction going this way, and he had almost full range of motion within one adjustment. Now I gotta treat that vertigo. Vertigo is basically having bouts of dizzy spells. The intensities can just be not being able to center yourself to full on, you know, the world is spinning. That's terrifying for anybody. We're gonna do Epley's here today. You ready to try?
No, but yes.
You are gonna get a little, you know, dizzy spells, so expect that. Your natural reaction is gonna be to close the eyes. Don't do that. Like, remember ballerina, they spot, right? That's how they do those turns. So they don't fall out of their dance routine.
Yeah, right.
Same thing applies to you.
So I'm really nervous because just once the vertigo happens, I just kind of feel really nauseous and unsteady.
Here we go, okay? I'm gonna let her walk you through Epley's.
Ready?
Yep.
Yep.
Epley's maneuver is a technique that we use to realign crystals in the inner ear that may be not in their normal location that can, at times, cause vertigo.
Feeling all right?
Yep.
Just guide the side of the table for us. Ready?
Yes.
Yep. We're gonna do it all at once. There it is.
This is a maneuver that you can't do at home, but I want to make sure that he's doing it properly.
You okay now? Mm-hmm. Ready? Back on your back. Good job. Let's sit up. Good job.
How are you feeling right now?
A little dizzy when I sit up.
That's okay. We were expecting that, all right? Doing it one time is not going to be like, one and done, I have fixed you. Ah, that's not the way this works. Usually it does take a repetition of Epley's maneuvers to kind of help with the vertigo.
Right.
So pay attention to maybe just every little thing, and I'm here. I'm not going anywhere. You get to reach out to me whenever you want. Did an awesome job today, okay?
Thank you so much.
You could just kind of see that he was like, okay. He's happy. You can see that he's calm.
I feel like I'm not so hunched over.
He looks looser.
On the way here today, I was a little bit nervous and kind of skeptical because I had never done this before. But, you know, honestly, I just told myself that I needed to be open-minded to it. I feel 100 times better than I did whenever I originally got here. So because my legs don't bend, I have to, like, boom, boom, go like this.
Yeah.
Stop.
Wow.
That was awesome.
I'm super excited to have my pain relieved.
I think the long-term goal here is to keep introducing chiropractic care, especially into the neck where he utilizes it so much for his daily habits. I really hope this is just a baby step in the right direction for him. Have an awesome day.
You too.